You know, when Mark started as the executive vice president, the organization was quite small in terms of numbers of members, size of budget, and at that time didn't even have a foundation.
Yeah, I think Mark has done a spectacular job ever since the very beginning. Certainly the meeting, the annual meeting, and the whole organization is very, very different than it was when we were scrapping for every nickel and trying to figure out how to get to the next meeting.
So we've gone from basically a $2 million organization to a $42 million organization.
Rheumatology's grown, and Mark has been part of that. I think the ACR must be one of the most successful specialty organizations in medicine.
One of the many qualities that Mark has brought to the organization is that he is not only a supporter of the organization, a builder of the organization, but he's a friend of the organization.
You know, we play multiple missions. It's education, it's research, it's advocacy, and you can't do it for nothing. And Mark understood that if we couldn't support research, we wouldn't have a specialty.
I look at research as the foundation, and without a strong research program, you won't be able to move the specialty forward like we've been able to do.
Yeah, when I was president of the ACR, and with Mark's support and encouragement, the ACR provided $5 million to the foundation in the early phases of the Within Our Reach campaign.
I think it shows a major commitment, and that's what donors are looking for. If you aren't committed yourself, why should I give? Well, in this case, we are committed, and we gave.
I was the treasurer when the ACR gave that first gift for to start the second campaign, and we sort of put our money where our mouths were, so to speak, and we thought that it would demonstrate that the ACR was really in full force behind the campaign, behind the reasons for the campaign, and the recognition of how critical it was for the survival of rheumatology.
All rheumatologists, whether they're doing basic science at a laboratory bench or seeing multiple patients during the day, have the same goal of improving the lives of patients with rheumatic disease. Mark Andrejeski has been critical in helping to maintain that union and understanding and seeing the value of it.
It's hard to predict where we're going to be in 10 years. The biggest challenge is workforce.
We've had more highly qualified individuals applying for rheumatology fellowships in the last couple of years than we've had in a long time. And so we have individuals who want to be rheumatologists, but there's no room for them because we don't have training slots. I would hope that they would be able to raise more money to continue and to grow the programs that we have.
We need to think about better recruitment. We need to think about more innovative ways to care for patients. There's no question that the knowledge that we're gaining on the basic science side in all of our rheumatic diseases is fantastic. So it's a great time to be a rheumatologist.
We had this fascinating concurrence of the development of biologic therapies during Mark's tenure. And in my view, the study, the testing of the biologic therapies has not just changed the lives of patients, but it's really given rheumatology a leadership role in medicine. It's been, I think, one of the most important changes in all of medicine.
I just want to say, on behalf of the foundation, thank you, Mark.
If they feel that I've enriched their organization, my life has been enriched twice as much by the association that I've had. It's been a pleasure. It's been a true pleasure and an honor to work for such great people.